Hi, I'm Carolyn Lehman, and I will be discussing MRIs today.
Hi, my name is Charles, and I will be reviewing CAT scans.
Hi, I'm Ruth Naima, and I'm going to be discussing ultrasound.
Hi, I'm Meghan, and I'll be talking about x-rays today.
Okay, so today we're going to be discussing radiology and some main types of radiology, including CAT scans, MRIs, and x-rays and ultrasounds. By the end of the lecture today, you should be able to understand how they work and what they're used for, including diagnostic procedures and other things.
So this is what an MRI machine looks like. You can see the person going into the middle of the tube. MRI stands for magnetic resonance imaging. So how it works, it uses a magnetic field and radio waves to create detailed images of the organs and tissues in the body. The magnetic field temporarily realigns hydrogen ions in your body, and the radio waves cause these ions to produce signals, faint signals, which are used to create the cross-sectional MRI imaging. What it's for is you'd get an MRI to diagnose if you're having any pains or any issues, and it's most frequently used to diagnose aneurysms, multiple sclerosis, spinal cord injuries, strokes, and tumors. Right here you can see the image of a tumor in the brain, and you can see that through the MRI imaging. So here you can see, here's an MRI of a healthy brain, and over here you have a brain with multiple sclerosis, so you can see the plaques and lesions in the brain that shows up on the MRI. This right here, we have a spinal cord injury, so you can see in both images, you can use the MRI to visualize the spine compressing the spinal cord, and here as well you can see where the arrows are pointing. In this image you can see the MRI of a brain with Alzheimer's, so these spaces are abnormal findings in an MRI, and that's how they diagnose Alzheimer's. So I have a video where you can kind of see how the MRI works and what goes on.
Hi, I'm Dr. Kate. So, you need an MRI. MRI stands for Magnetic Resonance Imaging. Like X-rays, MRIs take pictures of the inside of your body, but they're more detailed. Medicine first, to help them what happens. First, you change into a hospital gown. You'll have to take off anything metal like jewelry, watches, and glasses. The MRI machine won't work right if you're wearing metal. The MRI machine looks like a giant donut with a table or narrow bed that slides into the donut hole. The donut is actually a scanner. You may be given headphones. They'll help you talk with the technician, tech for short, and you can use them to listen to music. When the scanner is over the area that your doctor needs to see, it will begin to take pictures. If you're awake for the MRI, you might notice that it's kind of like being inside a short tunnel. Since you need to lie still for a while, try closing your eyes and listening to music. Once the test starts, it's important to stay completely still, just like with an X-ray. You'll hear the MRI machine whirring, banging, knocking, and clicking. It's loud. Even though you may feel alone, you're not. The tech will be watching and listening to you for the entire test.
You're doing a great job, Sierra. We'll be done soon.
When you're done, the tech will slide the table out of the tunnel. And that's it. MRIs may seem scary, but they don't hurt, and they...
Alright, so that is your MRI. So very important to know about an MRI is that really the only risk or the only contraindication is metal. So there's no risks with it, no problems with it. You can get dye injected with an MRI, and that has its own risks, but if you're getting a regular MRI, it's not dangerous at all. You cannot have, however, any metal. So any metal in the room is dangerous, and even something as small as a paper clip can be lethal if it's in the same room as the machine when the machine is on. So contraindications would be people with certain metal devices and implants, anything like artificial heart valve, the pacemaker, cochlear implants, a bullet, or any metal fragments in your body would pose a risk. So if you have any of those, you may not be able to get an MRI. And also, if you have any hair clips or anything metal in your clothing, it's mandatory that it's any piercings as well, that you must remove them before entering the MRI.
Okay, so I'm going to be talking about diagnostic ultrasound. So this is a picture of an ultrasound machine and the doctor doing the ultrasound. Ultrasound is an imaging method that uses high frequency sound waves. So ultrasound is an imaging method that uses high frequency sound waves to produce image of the body. So this is an example of ultrasound, and it's showing like the muscles of the body and the ligaments. So you can get an ultrasound done for many reasons, including viewing the uterus and ovaries of a pregnant woman, and diagnosing a gallbladder disease, checking a thyroid gland. And this is a picture of a doctor checking the thyroid gland of somebody who's probably has some enlarged thyroid, and they have to do this procedure to make sure they have this problem. So far, there are really not any risk factors. This procedure is very safe. So anybody can get this done. It has no contraindications. There is not much preparation for this procedure, except for a gallbladder. If you're going to get a gallbladder ultrasound, the doctor might require you to go NPO for up to 6 hours before the procedure. Or if you're pregnant, the doctor might tell you to keep a full bladder 2 hours prior to the procedure. Once the ultrasound tech person does the procedure, they're gonna explain everything to you, and then they're gonna forward their information to your doctor, and then your doctor is gonna contact you if he or she has any complications, sees any complications, or has any worries to tell you about. But other than that, that's it.
Okay, so here we have a CT scan machine, otherwise known as CAT scan. As you can see, it's pretty similar setup to an MRI machine, except with a CAT scan. The patient lays on the table, which then moves through the donut throughout the procedure. CT scan stands for computed tomography, because, as seen on this slide, it gives a detailed view of internal body structures, and it can also show soft tissues and blood vessels. Basically, it works by taking an X-ray beam, and it's shown through the body, and it's received by a rotating X-ray receptors in the dome. From there, it takes X-ray slices, and a computer puts it together to give slices of the body. What is it for? It's used for emergent action. It's used during emergent actions due to the timeliness and efficiency. Basically, during trauma, a lot of times patients will receive CAT scans to see if they have any problems with their spine or their brain. It's also often used during surgical procedures because it can give surgeons a very precise image of where internal body structures are located. It's also used to find tumors and cancer, and it can diagnose heart, liver, and lung diseases. Certain risks with CAT scans. They do give off more radiation than simple x-rays because it's more of a series of x-rays. But even due to this, it's still minimal radiation and is not likely to cause any side effects. There is a risk with pregnancy, and also very often you receive contrast dyes, and you can get an allergic reaction to them. So the procedure, it's pretty similar to the procedure for MRIs. You just need to remove all metal objects from your body, and it lasts about 30 minutes. It's a lot less loud than the MRI. It's pretty much silent. You need to lay completely still to assure accurate results, and contrast dye may or may not be given. So you can just see here the pieces of the machine. So these are just some pictures of CAT scans. This is a head, a slice of a head, and here you can see a torso slice, and there's cancer circled here.
Okay, so medical x-rays are a form of electromagnetic radiation. This is just a picture of a patient receiving one. They use x-rays that travel through the body, and the way the picture is formed depends on radiological density. So this is determined by both the density and the atomic number with tissues. So with the bones, it's more readily absorbs the x-rays, and they produce a high contrast on the x-ray detector. The background is always black. Bones usually show up pretty white, and then the bony structures appear whiter than other tissues against the black background. So the procedure, you position the patient so the part being imaged is located between the x-ray source and the x-ray detector. The waves will travel through the body, and they're absorbed in different amounts by the tissues. And when they look at it, they can see if there's a break or any kind of abnormality. What it's used for, it can be used to diagnose or treat injuries. It can detect the types of fractures, cancer, tumors, just to name a few things, and also has therapeutic uses. So this first picture on the left is a picture of just a normal x-ray radiography showing a broken bone. The next is a picture of a mammogram, which is used to detect breast cancer or calcifications in the breast, which can be indicative of a certain type of cancer. On this slide, there's a picture of a CT scan, which is classified as a type of x-ray. It's just more specialized, and it makes a 3D image. The one to the right is a fluoroscopy, which uses x-rays and a fluorescent screen to obtain a real-time image of movement within the body or to view diagnostic processes. So the risks, they have a potential to harm living tissues. Exposure to x-rays at a younger age increases your lifetime risk. There's a possibility of cataracts and skin burns with extreme radiation exposure. The higher the dose per exam increases the risk. Multiple x-rays through your life will increase your risk, and women are at somewhat of a higher lifetime risk than men. And these are our references.